and welcome to the first Team Brief podcast of 2015. A very happy new year to you all. Today I'm having a look at the Avondale unit at Preston, which is being transformed into a step-down facility to try and ease the capacity pressures that we're currently experiencing. And I'll talk to you more about that a little bit later on. Also coming up on this podcast, we're going to be talking about a new nursing degree course that we've launched to increase our nursing numbers. We will introduce our new medical director and we'll be telling you about some new electric cars that we're using. So far, the new year has brought with it one of the busiest weeks that we have ever experienced in our hospitals. In last month's Team Brief, I outlined all of the schemes that we've implemented this winter to ease capacity problems. Some have had some good effect. However, the significant increase in emergency admissions, along with delays in discharging many patients who no longer need hospital care, have created enormous pressure in our hospitals. Thank you, each and every one of you, for your continued commitment to providing compassionate care in what have been extremely trying circumstances. I've walked around our hospitals and I've seen great examples of teamwork, dedication, flexibility, as you've accepted patients with a range of conditions onto your wards, looked after more patients than would normally be expected, and cared for inpatients in day treatment and assessment areas. There's not much that we can do at the moment to stem the flow of patients requiring admission right now. So we need to continue to make sure we're doing everything we can to care for everyone in our hospitals. As ever, the senior team will support in any way required, so if there's something you need, please do let us know. As I mentioned earlier, we're in the process of opening a new step-down facility on the Avondale ward. This month, Lancashire Care will be providing 26 beds in the Avondale unit at Preston, as well as 28 more community placements, which will help prevent unnecessary admission to hospital and, more importantly, give us capacity to discharge patients who no longer need our specialist care. 28 more beds then become available on a phased basis, again in the Avondale unit, to provide further inpatient flow. We're also working hard to increase staffing levels for nurses and healthcare assistants, and I am absolutely delighted to tell you about a new innovative undergraduate nursing degree course that we have launched with the University of Bolton. This is the first time student nursing places that have not been commissioned or funded by Health Education England will be offered, and that's going to help us boost our nursing workforce. We'll be offering 50 places a year, and the first students will join us in February. This is a groundbreaking development and shows what innovation and tenacity can achieve. Well done to everyone involved for getting this off the ground. It's a great way to take responsibility for tackling the national shortage of nurses by growing our own. And we have huge thanks to offer to Sue Reid, our nursing director, and Karen Swindley, our workforce and education director, for making this a reality for us all. Work's progressing to build a new urgent care centre at Chorley, and this is due to be completed by May. This centre will provide easy access to GPs and primary care, particularly at weekends and evenings, and will help to divert some patients from the emergency department, which again should help to ease capacity. Also, the conversion of a recovery bay to provide 4 extra critical care beds is on course for completion in early spring, and the new hybrid theatre being built at Preston to support delivery of the regional vascular service is due to be completed by April. So you can see there is plenty of development work taking place to help you to continue to provide excellent care with compassion for our patients. Now, you may or may not know about Your Hospital's Your Health programme, which is a major review of our clinical services and hospital estate to enable us to respond to the challenges that we're facing, to continue to provide the highest standards of care and services, and also to make sure that we're fit for the future. We've introduced a regular bulletin to keep you up to date with this. So far, we've asked teams in every directorate to produce a service strategy to develop an overall picture of what we need to do to deliver the right care in the best possible way in the future. These strategies are due to be drafted by the end of February. We've also appointed a number of agencies to work with us in parallel to map out how the hospital estate will need to work to deliver services in the future. Check out the first bulletin on the homepage of the intranet for more details. Well, that's the end of part 1 of this month's Team Brief. Please click on the links below to watch the next section.